Snug Piercings, what you should know before you get it done, coming up next on Consultations by a Piercer, episode number 14. So you might want to, pull up a chair and relax and stick around. For those that are new at the channel, welcome to the channel. Welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful, educational, and all that fun, valuable stuff. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here inside Skin Kitchen in Des Moines, Iowa. So I might know something. What we're going to talk about today is basically the rook's angry, mean little brother, located usually about mid-ear. It is through the antihelix, that ridge that some of us have, or fold, so to speak, usually about mid-ear or a little bit higher, done with a curved barbell. This is not a common piercing because it's a pain to heal. It's notorious for having issues. So you should know that going in. Healing time on these, 3 to 6 months, sometimes a year. They are a difficult piercing to heal because of their location and the amount of contact that area of your ear usually gets. Taking care of it, you're going to have to clean it a couple times a day using a sterile saline. I like Nail Meds Piercing Aftercare because it comes out in a fine mist. You can also use the wound wash version, which comes out kind of like a squirt gun or high pressure nozzle. Difference between the two is one you just spray directly on there and then wipe. The other one you need to apply to something else and then apply to the piercing, either through a cold compress or just simply wiping away and removing the discharge. The only other thing I suggest doing is at the end of your shower, pull your hair and everything else out of the way and just let the water flow over the area for about 30 seconds. That's not only going to help break up that discharge and help it melt away, but it will also cut down the likelihood of shampoo, soap, and other things getting in the piercing and agitating it. Now let's talk about cross-contamination prevention. Common sense stuff Mom should have taught you. Wash your hands so you handle it. Always handle it by the end. The only time you really need to have any contact with it is when you're actually cleaning it. The rest of it, leave it alone. No oral contact or exchange of bodily fluids on, near, around the piercing until it is completely healed. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Do not submerge the piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. There's microorganism in them there waters, and it will go in that open wound and cause possibly an infection. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis and changed often. Avoid contact with unclean objects. Culprits with this would be things like telephones, headphones, over-the-ear headphones, I guess, possibly earbuds, stethoscopes. Anything that's large enough to come in contact with that area needs to be disinfected or avoided until it is completely healed. Avoid contact with wet hair. If you have longer hair that comes in contact with the piercing, wear it up in a fun bun or in one of those wrap towel concoctions until it's completely dry to avoid contact. Wet hair with healing wounds and healing piercings, not a good combination and will lead to issues. Now let's talk about trauma, pressure, and abuse. Do not sleep on the piercing. And once again, just in case you didn't hear me, do not sleep on the piercing while it's healing. You need to figure out a way to either sleep only on your other side, flat on your back like a zombie, or not a zombie, a mummy, other monster. And Dracula, I guess. Dracula always sat on his back. Like, oh. Anyway, I don't know why that came to mind. Or figure out a way to elevate it off the bed. Most commonly suggested, what I generally suggest, is using a U-shaped travel pillow, one of those neck pillows, that wrap around your neck for long flights. Then put a clean sock on it and sleep with your ear in the center of the donut. That way you don't have all that contact and rubbing and movement all night long. Avoid tight-fitting things. Now think about this. It's right here. So putting on helmets, over-the-ear headphones, anything that's going to put pressure on the area, not only because it has contact, it needs to be immaculately clean, but also it's that rubbing and agitation is going to cause issues. Also, do not, wear like the wrestling head and boxing things. It's all kinds of stuff. Think about these things beforehand. If there's something in your wardrobe that's going to come in contact with that area of your body, probably not the piercing for you, because this one is touchy and doesn't like to be touched. Do not spin, rotate, move the jewelry. There's no reason to do that. It's not a fidget spinner. Don't play with it. Leave it alone. Once it heals, might be okay, but even that's kind of asking for trouble. Jewelry should be done with a curved barbell. Curved barbells seem to work best because they kind of fit more into that anatomy and get it it just seems to fit more comfortably. I would not suggest piercing with rings or circular barbells. It's going to stick out and flop back and forth and have a whole load of additional issues in the long run. This really needs to be something that has kind of a low profile and fits into the area, and curved barbells usually work best. Now, there's kind of two types. There's the threadless and the threaded. Either or will work. The thing about it is with the threaded, you do want to check the balls on a regular basis. Both ends usually come unscrewed, and they usually will fall off at the worst possible times. And they're a pain to find because they're really small. Now, downsizing of the jewelry should take place in roughly about 4 to 6 weeks. With this one, I generally suggest waiting 6 weeks. The reason why is we usually put a slightly longer piece of jewelry in there to allow for swelling. Once that swelling goes down, having that longer piece of jewelry is just going to increase the amount of movement that you're going to see and cause issues in some cases. So see your piercer, let them do it. They have the proper tools to do it, and they should charge for the jewelry, but they shouldn't charge you to change it. Now let's talk about pain. This is a little bit more on the pain side. It is a very thick piece of cartilage that we're going through. On most people, it is very quick. We try to do it as quick as possible. It's pretty much a direct pierce and insert jewelry immediately. There's usually not a lot of pressure, but it really depends on your anatomy and whether they went inside to out or outside to in. It can be a little touchy, to say the least. Aftermath, you'll usually have a lot of heat, throbbing, aching, etc. This is a piercing that's going to get bumped often. It's going to be like having a filler on the outside of your ear, and you're going to begin to realize how often that comes in contact with things or how many times you bump it. It's going to be tender to touch, sometimes in this case up to a month, and then even after that, it'll go through phases where suddenly it's tender again and you bump it. Anatomy. Now, with this one, the fold or ridge needs to be thick enough to support the jewelry. Usually, it's best if it is crowned enough or large enough that we can easily determine both sides of the piercing. If it's flatter, it makes it more difficult and more prone to rejection or migration. We really want something that we can just go straight through. The placement always is dictated by the anatomy of your ear. Like I said, it's usually kind of in this zone where it is on the outside, where it's thicker. Towards the top, it's usually more folded and then more kind of a solid piece. We try to go in the area where it's more of a solid piece. Things to consider before that you may not have thought about. The first one being is if you're going on vacation or not going to be at home or what have you, it's usually best to wait until after you get back. If you're going to Cancun in 2 weeks, dealing with this while you're on vacation and not be able to control how clean your environment is or, whether or not you're going to be swimming or not and all of that, it's much easier to wait until afterwards. And you're going to have a better success rate. Now, other thing you want to consider is if you're involved in any type of organized activity that has a dress code or a uniform. This involves, dance, sports, drama, speech, anything. If you're involved in any of these activities, you should discuss this with the person in charge before you get this piercing. This piercing is not one you're going to be able to hide, and it is not one that's going to do well with removing the jewelry and putting it back in. It will close almost immediately, even after it heals. 2, 3 years into it, you might be okay to remove it for short periods of time. But right at the initial period, right after the piercing, not a good idea. There's not really any retainer out there that's going to hide this either. Short of putting something over it, and that's not good either. And I always mention this last, sleeping in isolation. This piercing especially needs to be isolated as much as humanly possible. The more you bump this, the more you cause contact, the more prone you are to have problems. Well, that's it. That's everything I have to say about that today. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care. Thank you for watching. And check out one of these other videos floating magically around me.